Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
80% of people with disabilities live in developing countries. Here in Uganda, nearly 13 of every 100 people live with some form of disability. About 110 to 190 million adults around the world encounter substantial difficulties in their daily lives due to impairment, which sometimes can be avoided. One of such people is Justine Babirye. Babirye says she was born with no abnormalities, but according to her parents, her problems started from the neighbor's children.
Nga omanyi abaana bajja okuzannya kulaba baby biki ebyo. Bwe bajja ne baafuna rubber bands ne bazinteeka ku magulu gombi, naye mami wange teyasobola kiraba. Then nali nyambadde ne stocks. Then ne nsulamu paka nkeera. Then we nazisulamu kati mami wange yakiraba late. Kati bagenda okunkebera nga zaanyweredde ddala munda muli eri nga tebasobola wadde okukola ekintu kyonna.
Efforts to seek medical treatment were futile, according to Babirye, which resulted into having her lower limbs amputated.
Naye ne batuka ne babagamba kiri too late. Ne bagezaako teekako eddagala capsules nga tezongera kusima busimi.
The unfortunate childhood incident now places Babirye in the category of people living with disabilities in Uganda. International Classification of Functioning and Disability defines disability as a permanent impairment, activity limitation, and restriction in participation in any life situation resulting from any health condition, whether congenital or acquired. Dr. Emmanuel Ewochu is an orthopedic surgeon.
So you can have a congenital anomaly that can cause you a physical handicap. Congenital means something you're born with, okay? For example, you've heard of the clubfoot. So if you marry into a family with a familial illness that increases your risk of having a physical handicap, then be certain that you're going to produce children who might have physical handicap. There are conditions you call knock knees or bow legs, okay? These are conditions that you're not born with, but as you grow, your parent notices that you're probably having a physical disability, okay? And then there are conditions that are developmental as a result of aging.
Dr. Ewochu takes pride in using his skills to rehabilitate people like Babirye.
One of the commonest conditions we see in terms of neglected physical disability is fractures that have been mismanaged, okay? So in Uganda we have, there are very few orthopedic surgeons. I think the number is now averaging about 68 in the country. So accessibility to specialists is a bit limited.
Rehabilitation is a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Babirye is now able to walk. She got her assistive devices from Kosu Hospital in 2011.
Njawulo gye nninawo nnene nnyo era nkyebayiza ne Mukama Katonda. Kuba ndaba singa saafuna amagulu gano nga bagali bagatemako nga bisobola tambula. Nalibadde bisobola kutambula kubanga kati ntambudde wantu wangi.
Since 2006, Kosu Hospital, a private not-for-profit health facility in Kisubi, has been providing rehabilitation services to try and restore functionality for people on the verge of suffering severe disability.
Before COVID affected all of us in one way or the other, Corsu was able to provide about 5,000 to 5,500 specialized surgery every year. And twice that number of persons being treated through medical rehabilitation, being physiotherapy, occupational therapy, and so on. So it's a big number. We have seen the number going a bit down. It's coming up again, but last year and the first half of this year, definitely we have gone down. So I would say that this year we shall be able to perform about 4,000 specialized surgery, and again about twice that number of medical rehabilitation therapies.
Nonetheless, Dr. Ewochu says some conditions that can cause disability are preventable and treatable.
You want to make sure that you do certain things in your antenatal period as a mother to minimize risk for having a child with congenital anomalies, okay? So you must make sure you attend your antenatal clinics and take the medication as prescribed, whether be it nutritional or be it, for example, antivirals to prevent mother-child transmission of HIV.
However, it's not all rosy for people living with disabilities here. That is why they want government to do more in ensuring equality for them. For example, in 2017, the Uganda National Examinations Board recorded a significantly low enrollment and completion of children with disabilities in primary and secondary schools. In the same year, only 9% of children with disabilities were in school. 820 students with special needs out of 101,186 students sat the Uganda Advanced Certificate of Education examinations. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in